Hello, hello. Oh, it looks like a good group. I'm so glad. Welcome. You are all going to meet our VIP. It's Dr. Krol, and he's such a nice guy. But he really is a VIP to every one of us because he is the medical director at the Arbor Skilled Nursing. So it's very helpful. Can you see the typing? Is that the cutest thing? That's Dr. Krol brought us that. Everything that we say into this mic is like closed caption, and you can see it at the top. It's very interesting. Anyway, Dr. Krol is the medical director, which means when you break a hip, come back with pneumonia, whatever it is that you need, going from the hospital to the skilled nursing for a period of time, Dr. Krol's one in charge. So we all need to know him before we see him in a tough situation. He is board certified in internal medicine, geriatrics. He is board certified as the director of, what is it? Yes, certified medical director. So he is trained, the verbiage is actually trained in enhancing transition from hospitals to nursing facilities. And a lot of mistakes can happen with that, and a lot of bumps along the way. So I'm so glad that he has that special training. He's serious about helping all of us in our transition. Personally, Dr. Krol was born in Minsk in the Soviet Union. And he came to El Paso. His family moved to El Paso when he was 6 years old. Now I have a question for you. His mother, moving the family from the Soviet Union to El Paso, packed up some very special things that she was afraid we didn't have in the United States. So I want you to yell out, what do you think she brought with her? Just yell it out. Snowsuits? Good guess. Soap?
I'm not sure about soap. Maybe, but I don't know if she bought soap. She might have.
Okay, come on, I need another guess.
She bought the nicest new clothing, the highest fashion in the Soviet Union in the late 80s. And I came to school and I stood out. I had Moses sandals, those big funky sandals, and little Nike shorts, and like white beater, which was like the classic look in Russia. And so I had all the latest clothing from the Soviet Union, but it did not really fit the American.
Do you know what else she brought? Pots and pans.
She did.
Didn't think we'd have them in the United States. But Dr. Krol's wife is Heather. She's a licensed psychologist. They have a 2.5-year-old son who just decided to get sick because they're going on vacation at the end of the week. But there's plenty of time for a little guy to get sick and get well before the weekend. He's going to talk about normal aging, what's not normal, and what we can do to make our normal aging the best we can for us. And I love the little writing. We're going to try and see in the future if we can do that and maybe get it a little larger. But we'll have to talk to Microsoft about that. So please give Dr. Krol a warm welcome.
Thank you all. I'm so glad to be here. I see some friendly faces in the crowd. And for the people that I don't know, I'm looking forward to getting to know you all at some point in the future. Maybe just passing by in the hallways. So if you ever see me, always say hi. I'm glad to learn a little bit about all the great stories that are here in Westminster. So I had the challenge of talking about normal aging, And the challenge is that you all know it way better than I do. So that's my biggest challenge, is I'm going to tell you a bunch of stuff that you guys have actually experienced, and I'm just reading from textbooks. And I think the goal for me is to think about normal aging, to get you all a little depressed about life, and then think about my two favorite patients when I was a geriatric fellow at Duke, and to use that information to hopefully help us all think about how we're aging and the way we think about aging, okay? At the end of the slides, I would like for us to put our heads together, because the world is changing very quickly, technology is changing, societies are changing, and I'm going to have an ask of y'all to kind of think about what can we all do to kind of help things forward. And so as we go along, the first part a little depressing, second part a little thought-provoking, and the last part will be an ask for us to all kind of put our heads together. And I hope we have some time at the end to think about the final part of the challenge of aging, okay? One of the many challenges. So I'm going to talk about the different components, and I'm going to start off with the heart. So things are changing once we're aging. The heart naturally gets stiffer, and so the blood vessels get stiffer, so your blood pressure will naturally go up with aging, a normal part of aging. All your blood vessels can have increased hardening and calcification, so coronary artery disease just increases with aging. The heart's ability to work becomes a lot harder, so it's not working as well, and so heart failure and heart issues become just more common, especially after we get over the age of 75. So when you think about people that have heart issues over the age of 75, a lot of them, people have it beforehand, but really that's a challenge. As your heart has scar tissues and other things build up over time, irregular rhythms become a bigger issue. So atrial fibrillation and irregular rhythms, it's a big component of older age. Okay, so all of that naturally progresses with time. With normal aging, your lungs also change. So the surface area that allows for oxygen to exchange becomes smaller. It's a third of the amount, and your lungs become less elastic. So while most people, even when they get older, are able to breathe without requiring oxygen, once they go to higher altitudes, or change in altitudes, it's very common for older adults to not be able to tolerate it as well as they would have before. So maintaining the oxygen level at higher elevations becomes a little bit harder, and your ability to kind of keep going before you get out of breath becomes a lot shorter. So your ability to have the resilience to maintain your oxygen becomes just shorter with time. Also, your awareness of low oxygen becomes lower with time, and that's very challenging, and it was a big challenge. I was the director for the COVID outbreak for Austin, Texas, for the nursing homes, and that was a big challenge for a lot of the residents that got COVID in the early years when it was really, really scary in 2020, because they just wouldn't feel it. And they would be arguing. In fact, I had my favorite patient from Round Rock. She had COVID and her oxygen was super low, and I told the family, I was like, bring her favorite food, and she wanted some hamburger from like a restaurant, and she was like, I'll eat it, but I'm fine. Like, and she was fine. She was completely fine. She's like, what are you guys talking about? And all of her labs and everything looked horrible, and I was just really kind of giving her her last meal. And she was like, what's going on? She could not believe me. And thankfully, she was correct. I was wrong. So, but she just wasn't able to feel the change in her oxygen at all. The kidneys also have decreased function. And this is super important for us to think about. One of the big challenges that I have when I talk to people is that people are like, well, I've been on this medicine for forever. Well, your kidneys were a little different 10 years ago than they are now. And so your ability to process the medicines that you're on becomes very different when you get older, because your kidneys are just unable to clear things as well as they did before. So some medicine can build up in your system when you get older. that they might have not when you were younger. So the ability for your kidneys to clear things changes. Your kidneys are also important to making vitamin D, and vitamin D is super important to keep your bones strong. So when your kidneys get older, your level of vitamin D that your kidneys are making becomes smaller, okay? So things are changing. Muscle strength. In fact, upper extremity muscle strength gets fairly well preserved, but lower extremity, getting up and down, standing, decreases a lot with aging. And your ratio of muscle to water to fat in your body changes, where you have decreased amount of muscle, increased amount of fat in your body, and that's a normal part of aging. And so your ability to keep standing up straight and getting up from the ground up becomes a lot harder when you get older. Obviously, everyone here has experienced it more than I have, but it is harder to get up once you get a little bit older. So the other part is recovering from injury. Your ability to bounce back. The classic hospital story that they tell us in the hospital is 1 day bed rest in the hospital is 1 week of rehab in a facility. So when you think about you're in the hospital for 5 days not moving, think about how long that takes for you to fully recover. In fact, I was part of a study that was working in the VA at Duke, and all they did was they hired lay people from the community just to walk with people. And they've done these studies, they're actually really brilliant. They had I think it was on their wrist or on their ankle, where they monitored how long people were lying in bed in hospitals. And the hospitals are just designed, TV and a bed. And so people that could walk around were just lying in bed 18 hours of the day. And so they were just noticing how much they were actually just losing muscle mass just from lying there. And so what they would do is they would find people and they just ask them, "Do you want to walk?" And they just walk with people. And people spend one less day in the hospital because they were just getting stronger, and a lot less of them went to the nursing home just because they were just stronger. And so little things like that, it's a big deal. Your ability to recover from lying down becomes a lot harder when you get older. Your bones become frail when you get older. That's different for men and women, and there's a very stark difference. Women after menopause will start to have a very steep decline in their bone strength. Men after the age of 75, you will start noticing the same decline. So for women, anyone postmenopausal, the classic is like a white female. It's the one that's most at risk. And they're just really high risk for frail bones, and so monitoring bone health. Men, not so much in the early days, but after 75, we catch up to the ladies as far as risk for fractures as well. Incontinence becomes a big taboo topic that we don't like to talk about, but we're all kind of dealing with. Women, it's hard to stop. Men, it's hard to start. That's the way I kind of remember it. And so, but urinary retention, the prostates get larger, so it's hard for the urine to come out. And for women, especially from birth, from giving birth back in the day, there's a lot of less rigidity, and so there's a lot of increased stress incontinence and other incontinence when they're laughing or moving that can cause intermittent incontinence. Aging. So interestingly, I think this is one of the ones where we all assume, when I hear this constantly, well, I'm just normal aging, it's normal for my age. The actual aging process with memory is not as clear-cut as you think. They did this really interesting study back in the day on community-dwelling older adults, and they made them memorize a long list of words. No one could actually remember the whole list of words, so it's purposefully designed to make you see how many of those words you can remember. And they asked the young cohort to remember the same words. The actual difference between the two healthy populations was not significant. But when they asked the young people why couldn't they remember all the words, they said, oh, that list was too long. Oh, like, that's impossible to remember so many words. And the older adults were like, oh, my memory's going. So even though they remember the same amount, the way they perceived it was so different. So old memories or long-term memories, skills that you developed, well-practiced abilities actually preserve fairly well. Recognizing familiar faces and objects usually gets preserved very well. And judging distance, actually one study showed that it was better. Older people were better than younger people. So, I don't know. They did see that in the study. The decreases in executive function, ability to make complex decisions and kind of rationalize all the different components of a complex decision. Attention span kind of decreases with time. And problem solving, especially for unfamiliar things, so being able to figure out a complex new gizmo and gadget, technology, being able to figure out something new that you were not exposed to when you were younger becomes much harder. But there's no such thing as normal cognitive aging. So if someone comes to me and they say, well, my mom and dad are not remembering things as well, they're forgetting how to take their medications, that's not normal. So if someone remembered how to take their medications beforehand and knew how to do that and they still can see everything well functionally, then I would be very concerned about that as a change. That's not a normal part of aging. We have people here, I'm sure there are in their 90s, maybe some hundreds, that are able to do a lot of these things, and so that is not an expected part of aging. It is more common, but it's not an expected part of aging. Vision, decreased lens elasticity, so wearing glasses and reading glasses becomes a lot more common. Decreased visual acuity, high frequency sounds become harder to hear, and decrease in speech recognition in a noisy environment, being able to differentiate things when a lot of people are talking. There's actually a change in your taste and smell, so your ability to smell spoiled food or be able to becomes a little bit harder, so you're not as sensitive, your smell becomes less sensitive. That's a challenge with gas, and sometimes when gas is left on, older adults might not be able to recognize the smell of the gas, where a younger person might be able to catch that. And food requires a little bit more sugar, a little bit more salt in order for you to taste it, because it's just the taste sensitivity is not as strong. Okay. So I wanted to come over what is not normal aging and things that people bring up to me that when that happens, it's not normal. So chest discomfort, aches and pains happen, but if you're having chest discomfort or pressure in your chest, difficulty breathing, that's not a normal part of aging. Shortness of breath can happen, especially with extensive exertion, but acute onset of new shortness of breath is not a normal part of aging. Burning or pain when you urinate is the most common sign of urinary tract infection. It could be other things, but just because you're having pain, burning, you should definitely tell someone about that. Increased falls, pain, even though arthritis is far more common in older adults than in younger, just because you have pains, it's not normal. You should definitely talk about new pains. There's been a lot of times where there was a broken hip, or there was something major going on where people were like, well, I'm just getting older, and that's not the case. Definitely want to make sure that someone's talking about it with you. Increasing falls, that's new. Memory loss impacting daily living. So my father constantly tells me that he's losing his memory, but he's actually able to do all of his day-to-day activities. I think once I'm really concerned about memory loss is once things that you were able to do really well in the past are now becoming a lot harder for you to do, and people are noticing, well, this is something that he was able to do before, and now he's not able to do it. One-sided weakness, one-sided hearing loss, and acute eye pain or acute vision loss. So if it's slowly getting worse, it's one thing, but if it's getting worse really quickly, definitely worth bringing up with a doctor. Okay, so that was my depressing section. I'm done with that. I want to talk about impairment versus disability, and I'm going to talk about two of my favorite patients. They were both in their mid-80s, and they were living in a CCRC, kind of a continuous care retirement community, just like this, a little bit smaller. And I had the privilege of working with both of them. One was a female, and she had a lot of arthritis. She was very debilitated. But I think in her past life, if she could have lived all over again, she would have been an engineer, because she just loved to create different gizmos and gadgets. None of them were like officially endorsed, but she would get some kitchen utensils, and this one's designed to pick up certain items, and then she would develop a longer utensils for different items. And she had her walker. It was a regular non-wheeled walker, and she slowly would move around with her 20 different utensils, all appropriately positioned everywhere. And she was able to do everything she needed to do to get around, to make her life happy, and she was able to live at home. And so if you asked her, how do I get this? She had a protocol, and it was well engineered, and she had everything in the right place. My other patient was a very proper gentleman who came to me in clinic one day because he wanted to figure out what to do about his falls. And so I started thinking about it, and I was like, when do you fall? He said, whenever I go to the bathroom. And I was like, okay. I was like, what's going on? He's like, well, when I try to pee, I lose my balance a little bit, and so I fall. And I was like, why don't you pee sitting down? Because men don't pee sitting down. And I was like, so you're willing to break your hips so you stay like a man? He's like, yeah. He thought about it. He's like, yeah, I don't want to pee sitting down. And so I think these two patients, which are, I just love that story, and I just cracked up when he told me this. But I think he was very serious. The concept of loss of your ability is such a scary thing. It's a conversation that I constantly have with people in the nursing home settings, because the ability of going from independent to dependent, from being CEOs, CMOs, being in charge of your house, to having your kids be in charge of you, is a very overwhelming and scary thing. And I personally haven't experienced it, but being a part of those conversations, I definitely can feel it. And having the dignity of I'm standing and peeing being the thing where he draws his line, I could see where he's coming from to some extent. And then I could also see rationally how he is making his life so much worse for something so dumb as to stand when he's peeing. No one knows what you're doing when you're peeing. So I want to think about these two people when we're discussing about some of the complications. So hearing loss. Hearing loss is a common complication, and it's a common complication from both men and women, where I see the peeing man come out, right? Where I don't want to show off that I am wearing hearing aids or that I can't hear, and I don't want other people to know that I can't hear so well. So you know what? I'm just not going to go to these events, because I don't want to expose myself that I'm getting older, and I don't want people to see that I'm wearing hearing aids. My own grandmother is one of those people, and she's very adaptable in other ways. Hearing loss in itself has been correlated with social isolation, has been correlated with increased risk for dementia. So it might not cause dementia, but people that have hearing loss are higher rates of dementia than people that don't have hearing loss. Increased communication difficulties, increased depression likely connected with the isolation, and decreased physical activities and frailty. And that might be connected. The theory is that they're not going out of their house, they're sitting longer, so they're getting frail, and so they're not doing as much movement. So let me go back. So what can we do about hearing loss? Hearing aids. It's wonderful. There's other things that other people use, so you don't have to just use hearing aids. The new iPad Pro, these little devices now can function as hearing aids. They're not as good as the ones that you get custom for $5,000, but these cost $200, and they're actually pretty darn good. There's amplifiers that you could just get that you can wear. So if you're going to a theater or something, you don't have to buy something for $5,000 if your hearing is not that bad. What else can you do? You guys do this all the time. You have a name tag, so you make sure you go to places where there's not a lot of people, there's not a lot of loud music, so you can actually interact. So if I invite a lot of you all to bar, that's a dumb thing to do because it's just not going to lead to very good conversations. And if we have those conversations in a quiet place where we can really talk, then I think we can have a lot of great conversations. So thinking about the environment that you are going to participate in and how is that allowing people to be part of it, okay? So it doesn't all have to be with technology, but it just has to be with how do we work around it. Letting people know that you just can't hear them, can you restate things? How many times are we just so afraid to say that we go on without listening to what people are saying? So we all can do our part to kind of make it better. Like this little device where it just writes what you're doing. Technology is changing very quickly, and so there's lots of different opportunities to have subtitles and other material being read to you. So visual loss. So there's a bunch of things that can be done for visual loss. Sorry about that. So technology is getting actually quite impressive. So this little phone can do a whole lot of things for visual loss that we just are not aware of. So if I turn on my phone, and there's a thing called Seeing AI. It's a free program. It uses artificial intelligence. It can identify people's faces. It can read and translate anything that anyone writes. So if I take a picture of something, it could be a menu, it could be a chapter in a book, it could be something on the table and you're not really sure what that is. So I'm going to take a picture of this. It's processing it. Okay.
Niagara registered sign purified drinking risk.
So it was able to read it and tell me that it was a bottle of water. So that takes like a few seconds, but it can do that for all sorts of things. So if I take a picture of you all, I have no idea what it's going to say.
Processing.
Sorry.
Describe 6 faces. Processing. The image depicts a large gathering of people seated in a spacious room. The room has a ceiling with recessed lighting and several large circular light fixtures. There are rows of chairs arranged facing a podium with a microphone, suggesting a presentation or lecture setting. The audience consists of predominantly older adults. The seating is arranged in multiple rows, with people sitting closely together. The room appears to be well lit, and there are visible elements such as a projector and a screen at the front, indicating a setup for visual presentations. The walls are light-colored, and there are a few columns visible within the room.
So if you can imagine, they actually have this version that's on glasses, so you could click it and there's a microphone, so you could kind of interact, so you could click it, looking at a page in the New York Times and it'll read it to you. So I think the world is changing very quickly, and so the reality is that there's a lot of options that are available that we just don't realize. There's another website called Be My Eyes, and there's volunteers around the world that if you take a picture with a camera with that app, they will tell you what's going on. So instead of an artificial intelligence, there's people that are volunteering their time to help people that are visually impaired figure out the world around them, and they could talk to you about it. There are books that you could rent that are ebooks, so you can still continue to read your books even if you can't see very well. And there's obviously systems that are both on your phone that can magnify things, so you could kind of magnify things at home or when you go out, so you can actually see what you're reading and what you're talking about, okay? So the world's just very exciting, it's changing very quickly, and I think that adapting and not being the man that's peeing, but being the lady that's using the contraptions is the goal. Functional loss. My grandfather, I hate pointing out people that I know, but he would not use a walker. That walker he was too cool for a walker until he had a fall, and then he had to use a walker, and then he was really good at using his walker. So the idea of having to use a walker, having to rely on a wheelchair is very scary and uncomfortable, and there's the balance between independence and dependence, and having a walker can actually give you more independence. I didn't talk about that before, I kind of missed it, but I want to make sure that I explain the difference between, impairment and disability. So someone has impairment means that they are unable to do something, right? I have impairment, I can't fly. That's an impairment, I guess, of mine, right? We all have impairments. Some of us are impaired in how fast we can walk. Some of us have more severe impairments to where we can't walk, right? Disability is the inability to do a certain task. Just because I have an impairment doesn't mean that I have inability to do a task. Like this gentleman might not have the ability to go up the ramp, but maybe with an electric scooter, he would have the ability to go up the ramp. So he's not disabled in that instance for that task, okay? So just because you have an impairment does not mean it has to lead to a disability, right? There's ways around it. And that's kind of an important thing to talk about because we always assume impairment means disability, and that's not always the case. So what do we know about functional decline? The one thing that has actually been proven time and time again is physical training. And the thing that I noticed that is challenged by a lot of the research is a lot of the training that we do is like chair exercises, where everyone's really afraid of falls, but really weight exercises or resistance training has been shown far a way to be the better way of doing the training. They had, in the VA, we did training, weightlifting sessions, and there was a 102-year-old lady, and that lady could barely pick up a 2.5-pound dumbbell. But she was in there, and she was training at 102, and it's really powerful because it allows you to really build muscle mass, because you really need the muscle mass to maintain your strength. And the big muscles, when they go, it's really hard to rebuild that without doing chair exercise and doing exercise where you're sitting. I think a lot of, unfortunately, understandably, but unfortunately, a lot of the training sessions are really worried about having falls because they don't want the liability. But what that does is it really limits your ability to really do those big exercises that you need. And so finding that balance, obviously, of safety, but also pushing yourself to use really strengthening bands or actual weights is super important. So I kind of wanted to show that lady that's doing, was working with big weights. Because there's a lot of evidence for that. Cognitive loss. There's actually not that strong evidence for a lot of the vitamins that we take. It's not probably that much harm, but there's not much evidence. There's a lot of evidence for exercise. So movement. A lot of the cognitive deficits that can happen is because of many strokes and so the idea of getting increased blood circulation to your head by doing a lot of movement, it's been very well studied for cognitive deficits. Less studied, but still has, well studied, but has less evidence for is socializing. So definitely lack of socializing has been shown to cause cognitive decline. But increased socializing has not been as clearly studied, and playing games, word games and stuff like that, there's a question mark of how much it actually helps. But all of those things are very easy to do and recommended. But the most important as far as cognitive function is movement. Okay, here's the last one. And this is the one that I want us to end our talk on. And the one that I want us to keep thinking about as we kind of go on. I was actually talking to one of the residents that lives at Westminster when I was visiting her in the independent living. And I was telling her that I was going to talk about loneliness and isolation. She's like, this is the wrong crowd to have this conversation with. Because you guys are probably the least lonely and isolated group of older adults. And it's still an issue. And it's definitely a large issue in the community for the people that don't have the opportunity that you all have. When you're looking at 2020 and we're thinking about COVID, and after COVID, the world changed for everyone, but especially for older adults. Especially for older adults living at home, the world became so isolated. There was a very famous researcher who studies this from Houston, And he gave a talk, and he's told me, he's like, why does anyone think that exercise and socializing different? You have to practice socializing in order to know how to do it. The longer you don't practice it, the easier it is not to socialize. The more excuses your brain will say not to go to that event or not to do something that is socially scary to get yourself out there to play a game when you could stay at home and watch TV. And so the process of isolation becomes very, very powerful, and the drive to socialize becomes harder and harder because your brain will give you plenty of reasons not to get out of your room. And so when you look at the pandemic of loneliness, you could see that among older adults, around 56% felt they were lonely or isolated in 2020. And while that number has come down, it's still very high, it's 34%. And you could directly connect isolation with a lot of disease processes. And the more they study this, the more connections they're making. People who are isolated, increased risk for death, increased sicknesses, higher rates of depression, higher rates of cognitive decline, higher rates of functional decline, increased risk of strokes and heart attacks, the weakened immune system compared to people that are not isolated. It's a very strong predictor of death. And increased alcohol, smoking, and drug use, but mostly drug uses in younger adults. And so why is this happening? I think that I can see it definitely between women and men. I think women naturally, my wife has a whole, she doesn't really need me, she likes me around, but she has her group of girlfriends, and she has the time of her life when I'm there, when I'm not there. I'm very proud of my work that I do, and I love helping people, and I love my family. And if I wasn't working, if I was retired, that'd be a huge component of my life that would be gone, right? And I think the same applies to a lot of men, but also women. And I think when they lose their spouse, I think men have a harder time of reconnecting with the world that they live in, because that was a huge part of who they were and their identity. And I think we as a society do a very horrible job of looking out for one another, and we all kind of our own little silos. Outside of Westminster, you guys are amazing. But I think this is a problem that we really need to start thinking about what we can do, because this is a true pandemic, a true catastrophe. Younger adults are more isolated than they ever have been before. They might not be on they might feel like they're not because they're on their phones, but they're just as isolated as they were without the phones. They're still in their room by themselves. Older adults are functionally limited, and the world that we live in makes it harder and harder for them to interact with their friends, unless it's virtually, and all that is not the same as it is when you're at home. There are programs that have been started in different parts of the country. In Houston, Baylor had a program where they had medical students and people living independent livings do art projects together. And their whole goal was just to have medical students learn how to talk to older adults, because older adults and young folks don't really interact. We don't really have a place like we used to where people will come from different ages and kind of get together. And so there are programs trying to get high school and middle school students to interact with older adults. There is a nursing home, it's a CCRC that I went to in Argentina on a mission trip, which has a daycare connected with it. And the older adults that are doing really well in the independent living side help take care of the kids from families that are really poor, and the moms need a place to work. And so the moms go and they are able to work. The kids are subsidized, so they don't have to pay as much. And older adults have something to do. They're really helping in a massive way to these families. And the kids have connected to a grandmother that they might otherwise not have. So there's really unique ideas of how to reduce the isolation that our world has. You all have huge amounts of knowledge and ideas and expertise that I feel is just being lost, and the younger folks are not learning about it and not talking to y'all. And the younger adults have a lot of joy of life and a lot of new expertise, maybe in technology, that are not being shared with y'all and that they don't know how to interact. And so I do think that there is some element here where this pandemic, which is real, which I see both in younger adults and in older adults, that we can all do a better job of solving. Because if we don't solve it, I think we're just growing farther and farther apart. Okay, so with that ask, I'm opening the floor up to everyone. If you have any thoughts or questions, that's all I got. Oh, I haven't reviewed the slides for a while, so I apologize. So I wanted to make a takeaway. Aging increases risk for impairments, but not all impairments are inevitable. So there are things that you can do. Don't just say, just because it's hard for me to stand up, that I'm doomed to fall all the time when I pee. Impairment does not imply debility. Goals for aging well, movement, socialize, be creative, and create a purpose. There's always a purpose that you can create. It just takes a lot of creativity to make it sometimes. All right, thank you.
Thank you.
Okay. Who has questions? Hands up in the air so I can get a mic to you. Roger, I knew you had a question.
Well, Dr. Krol, I want to underline what you've ended with. As a pastor of a parish in many places, one of the things we saw again and again, whether it was in the middle of the city of Detroit or out in the wealthy suburbs, it was pretty much the same. And that was the sense of losing your world. And a world that you hardly could understand was replacing it. And with that, you were losing people you trusted and had great conversations with, and you're never going to have those again with those persons. And along with that, we encouraged our youth groups to meet with older people they knew and start by saying, what was your world like? And invariably, the older person would say back, eventually, because she had a lot to report, she or he had a lot to report, and they'd say, but what is your world like, and how does it work now? And that interaction, because there's a great fear among the two generations in finding a wavelength to communicate. And the other great issue was executives who retired. They almost always came in just to talk because they lost themselves, who they were. And people would say, don't talk about the past, it's over. Find something new, redefine yourself, without realizing that was them. And there's a transition involved. And they were happy to be back in their old world in some ways. So it's a very, very challenging time of life on many levels. And I'm wondering if you've seen that.
Yes, thank you, that was very profound. Yeah, I think it's a very difficult time of life. I definitely, within the Westminster folks in the nursing home, the thing that I see is the executive. I think there's a lot of very impressive people among you all who they put their sweat and tears into creating what they created. And now they are in the nursing home, and what's the value of it all type of situation? And how do you create meaning and value now that you're no longer the CEO? You know, you're the guy that's wearing your depends in a nursing home. And so it becomes a challenge. And I do feel that the thing that saves those people, some of those people, is to have connections. And I think building those connections now, for me, for you all, to where there is other things that you are outside of just your line of work. And that's challenging, and I think one of the things that I think you do well with is people that have had a major loss. There's a community that kind of rallies around them. And I think that people that have had a major change in condition, I do see people from the independent living checking in on their friends that are now in the nursing home. I can imagine that that's very difficult to do because that is kind of being in a place that's very uncomfortable, seeing the challenges that can arise for you all as well, because anyone can end up in the nursing home. So, but I always value seeing friends and people coming to visit the people that are more debilitated and having challenges, and creating that community and reducing the loneliness and isolation that can be from moving from independent living to assisted living to long-term care.
Let me see if I can get my words together here. I think I moved here because I was alone in the neighborhood, and there were friendly people around, but they were busy. They were busy with younger people or their children, and the older people stayed behind their doors. And I thought, I was getting depressed and lots of the things you said, so I'm here. And yet it's sometimes difficult being here, meeting people on the same level of interest and, what's the word I want to use? Level of deepness that you can get with people that you've known for a long time. We grew our families without family near. We were thousands of miles away. So somehow we got that, but then we missed out on having family around us. Our children didn't experience that, not really. So I've got one who lives across Mopac, and because I'm close, I don't see her very often. She's busy. And I don't think it's because I'm not loved. I think it's because she never experienced that with elder people in our family. We didn't have it.
Yes.
I mean, the experiences as we grow older change. I guess that's what I'm saying. And we don't have the same experiences that we may have had as children or didn't have as children.
Yes, I think the natural separation of all the different people, I think technology and society has kind of separated us all, where before we'd all go bowling together in a bowling alley. There's no, I don't know who goes bowling in the bowling alley anymore. A lot of the things that used to bring the community together, we don't have them. We still have churches and we have religious organizations, but they're also less attended now than they were in the past. And so a lot of the things that would bring multi-generations together are not as strong. I think that our ability to volunteer and to engage other ways is not as available. So a lot of, I get sad because I think that a lot of the people in the nursing home can still give back, and there's ways of connecting with the community, but we just don't do it. We don't find ways to allow them to volunteer and to engage.
As an old pediatric nurse, I'm enthralled by this idea of the child care facility. I'm wondering if Chuck, instead of this lounge, we could do a daycare center. Just, but
I'm all in.
I'm in for it too. But I was wondering if there is a way that we could need a committee, to have kids come in once a month, once a week, something like that. I wonder if people would support that type of, because I think that's wonderful for the kids.
I don't know the answer, but I do feel that these are conversations that are not had because it's just so different than the way it's done. And I do feel I need moments that we can have touch points with younger adults, older adults, medical students, college students. There's just a wealth of knowledge and expertise here, and I just feel like both sides don't know how to engage with each other to really get the most out of it. The one that I've seen that was successful, they used art, and so they do art medium together, so it allowed them to have a common interest. So they would draw like a question, what do you eat for Thanksgiving? And then they would discuss it, and so it created an easier way for people to communicate without having to have an awkward moment, so to speak. But yeah.
I'm going back to your comments about hearing loss. which is very common in this community. And one of the things that can help with it a lot is that everyone use a microphone. And that's happened this evening, and I could hear you very well. But there are often people who say they may have been a teacher or a pastor and spent a lot of their career not using a microphone all the time and say, oh, I don't need it. But a lot of hearing aids can pick up on what's on a microphone better than just hearing a voice. And I think we just need to recommit to everyone, using a mic when they ask questions and interact in these meetings.
It's a good idea.
Yes. I wear hearing aids, and they are the ones that have a string that goes around my ear. And if I'm not careful with my hair and my glasses, the hearing aids fall out. And I heard you say that there are some hearing aids for $200. Are they ones that just sit in the ear without hanging around the ears?
So there's both. So there's companies that are selling, they're not true hearing aids. They're not as custom made for your hearing loss, but they are beneficial. And there's some that look like regular AirPods, like these. And there's others that look like you're wearing earplugs that kind of go around, and there's some that look exactly like a regular hearing aid. So there's all different versions of them, and they're becoming more popular. They're not as good for really complex hearing loss, but they could be good enough, and they're definitely a lot cheaper.
Anyone else? It's been an interesting talk. I think it's brought to my mind what a family we are here. And if someone is on their own at a meal or at anything, that we can make such a difference by engaging and getting to know people that maybe we don't think about that, we're thinking about ourselves. And I'd really appreciate you bringing that up, because we can be the difference maker for each of us. So thank you so much for bringing that up and spending the time at the end of a long day, but your wife has had to take care of a sick child, so hopefully he'll be better by the time you get home, and thank you so very much.
Thank you all.